So I thank you all for coming this afternoon. You may be happy to hear that I only have 3 slides to share with regard to intra-articular injections. First of all, I'd like to just share with you a bit of the purpose or indication of intra-articular steroids in osteoarthritis. And actually, it has some role, especially in areas like the first carpal metacarpal joint, or when there is worsening knee osteoarthritis with effusion. And really, this is an adjunct to all the other therapy that we will be mentioning later on, and also the pharmacotherapy that has been mentioned. And really, we must also bear in mind that these injections do not last very long. They tend to have benefit for about 2 to 3 weeks, and maybe up to 6 weeks at best. And really, it's hard to predict which group of patients will have a longer beneficial effect compared to others. So it's really one of those last-stage measures in order to tie a patient over a short period of time for benefit. And again, I'd just like to reiterate that oral corticosteroids should not be given in the treatment of osteoarthritis of the knees. Now, of course, there's another form of intra-articular therapy for osteoarthritis of the knee, and that will be in the form of viscosupplementation. And we have evidence to show that viscosupplementation can be used for the treatment of osteoarthritis of the knee. But bear in mind, this should also be considered only when general measures or systemic therapy have failed or are contraindicated because of one reason or another. And really the reason for that is simple, because it is fairly costly considering the cost-benefit ratio. And for this therapy, it is actually effective on pain function of the joint, as well as the patient global assessment. And meta-analysis have shown that really the most beneficial effect is between 5 or 6 weeks to the 13 weeks period. But of course, in some patients, it will last all the way up to 6 months or more. And this is in comparison with placebo. And really, because we do not have local cost-effectiveness data on this form of therapy, but you'll be intuitive to really consider this mode of therapy only when all the other systemic intervention has failed, especially the other non-pharmacological measures as well. And the same recommendation is still given for the steroid injection, which I mentioned earlier. So this is all found in the CPG book on page 21 and 22. And just a little bit of additional notes on the viscosupplementation. You are aware that there are different formulations. Some are given 3 weekly injections, some are 5 weekly injections. And studies have shown that it is effective on average about in 60 to 70% of patients. And the onset, again, is about 6 weeks or 5 weeks. So do not expect the patient to have immediate pain relief. So you have to warn them to be patient. And the effect in some patients can last up to 6 months. And it is actually as efficacious as non-steroidal anti-inflammatory drugs. And in fact, it can have addictive effect. In other words, for some patients, if you have systemic therapy plus injection, sometimes they do get even. And it has been shown to be more efficacious than intra-articular steroids in terms of the duration of efficacy. And of course, like all things, when the patients are mild, they tend to get the most beneficial effect. In fact, some studies will quote that if they are only grade A osteoarthritis of the knee, they can get up to 90% response rate. But bear in mind, these patients who are minimally involved tend to also do very well with pharmacotherapy or non-pharmacological interventions. So always try all those other modalities first before proposing this as a form of therapy. Thank you very much.